Glaucomas. In the first lecture, we discussed basic terminologies like tonometry, gonioscopy, and we learned primary open-angle glaucoma. Classification of primary glaucomas, of which we discussed primary open-angle glaucoma. In the second lecture, we discussed primary angle trail glaucoma. Now today is the third lecture, and the next one, the fourth one, will be the last lecture on glaucoma. Today we will be discussing secondary glaucomas, and in the next lecture we will be discussing the primary congenital glaucoma. So, as you can recall, glaucomas are classified on various bases, like primary glaucoma and secondary glaucoma. The difference is that in primary glaucoma, the disease is, there is no other ocular disease, and in secondary glaucoma, the glaucoma is because of some other ocular disease. That is the core difference. And primary open angle and primary angle glaucoma are entities or diseases which are present because of certain factors we have discussed. So today we will be discussing the glaucomas which occur as a compensatory mechanism or because of or secondary to some other disease. Okay? So, secondary glaucomas are the glaucomas in which some other ocular cause of the rise in the intraocular is present. There are many types of secondary glaucomas. I have chosen the most important. Number one of the secondary glaucoma is pseudo-exfoliative glaucoma. You can see this is pupil and a dandruff-like structure on the pupillary margin. It's called pseudo-exfoliation. ये उससे ही होता है जिससे स्किन में एक्सफोलिएशन होती है, जब फिल्म उतर जाती है. Pseudo-exfoliative glaucoma is secretion of a grey-white fibrillogranular material throughout the anterior chamber. Material similar to amyloid. Histologically, it consists of amyloids. जब इसको stain करते हैं, treatment is same as primary open-angle glaucoma. अब ये pseudo-exfoliation is a syndrome which can involve the eye or it can only involve the eye, and it just presents like primary open-angle glaucoma. That is, it is silently affects, and the treatment is same like medical treatment with beta blockers, pilocarpine, laser, and turbulactin ultimately. So, as the topic is lengthy, and we have already discussed in detail the treatment options like medical treatment, being the beta blockers, pilocarpine, and prostaglandins as the mainstay. On the second number, laser trabeculoplasty, and third, the surgical treatment, the filtration surgery, that is trabeculectomy, which I have repeatedly told you to make an anastomosis between anterior chamber and sublunar space. So it is the treatment of all the glaucomas. So same is true for secondary glaucomas in most of the cases, depending on the cause. Now this is another cause, pigmentary glaucoma. Pigment granules throughout the anterior segment. Some develop clavicular block, open-angle glaucoma. Treatment same. It is a disease in which, because of some pathology, unknown pathology, the pigments from the iris and the ciliary body, they disperse throughout the anterior chamber, and when they go and stuck in the angle, they don't close the angle, but they block the angle because of their deposition. So it decreases the drainage of the intra-ocular. समझ आ रही है आपको? It stops the drainage of the intra-ocular. And treatment is same like I have told you. Then neovascular glaucoma. Neovascular, you can see these are new blood vessels which can be seen on the sphincter pupil. Normally, iris is, though iris is a vascular structure, but normally blood vessels are not visible on the iris. If blood vessels are visible, there are two possibilities. Either these are new vessels, and the other cause is that iris is atrophied. There is atrophy of the iris because of some reason which has caused the normal vessels to become prominent. Now the cause of new vessels is always in the posterior segment in over 90% of the cases, and it lies in the retina as in diabetic retinopathy. And diabetic retinopathy is the most important cause. It causes ischemia of the retina, which causes development of neovascular membranes and new vessels on the retina at the disc along the arcade of the arteries and other blood vessels, and when the angiogenic factor is secreted, they may cause the development of new vessels at the iris, which are called NVIs. NVD stands for new vessels at disc. Then there is NVEs, new vessels elsewhere, that is other than disc. You will study these in detail when you will be studying the diabetic retinopathy. And NVIs, new vessels at the iris, because of the same pathology. And when the new vessels are present on the iris, it is called rubeosis iridis. Rubeosis for blood vessel and iridis for iris. So this is rubeosis iridis. So these blood vessels may go and they can also lie over the angle of the eye. And later on, if they contract because of the fibrous element and fibrovascular contraction, then it can present both as secondary open-angle glaucoma because of just the presence of blood vessels over the angle, or secondary angle glaucoma because of contraction of that membrane causing the angle to be closed. समझ आ रही है? ठीक है? तो जब ये एंगल है, एंगल के ऊपर आइरिस से ब्लड वेसल्स आ रही है, मेम्ब्रेन बन रही है, तो वो उसको मैकेनिकली ब्लॉक करेंगी, एंगल ऊपर होगा. अगर वो कंट्रैक्ट कर देंगी तो एंगल ब्लॉक होगा. तो दोनों सूत्रों में ट्रीटमेंट इज द सेम. न्यूरोस्टर glaucoma का ट्रीटमेंट थोड़ा सा इसमें एक जो एडिशनल चीज है, as the main cause is present at retina and the main etiology is hypoxia. What we aim to do, we destroy the normal retinal structure by argon laser, so that ये समझने वाली बात है, we destroy the normal retinal structure by laser, so that the demand of the oxygen of the normal retina is decreased. When the demand of the normal retina will be decreased, then the hypoxia will subside. When hypoxia will subside, the angiogenic factors will stop secreting. Ultimately, new vessels will regress. So this is the aim of doing uh, laser, which is called pan-reactant photocoagulation. That is, it is a destructive procedure. We on the slit lamp with argon laser uh, uh, do 360-degree laser burns to destroy the rectum. So, PRP, peripheral rectal photocoagulation, peripheral rectal cryotherapy. Uh, Alternatively, you can use cryotherapy, that is the freezing, to destroy the civil body so that it does not create the aqueous humor. Artificial filtering shunts is an option. Cyclodestructive procedures, that is, there are procedures which cyclo means civil body, which destroy the civil body so that the intraocular pressure is decreased by decreasing the production. And keep it in mind that from all the secondary glaucomas, glaucoma is the most most severe, and in most of the cases, the vision is already gone because of retinal damage. So we go for these destructive procedures because of our main aim in rubeotic glaucoma, not all secondary glaucomas. In rubeotic glaucoma, our main aim is not to restore the vision. Our main aim is to decrease the intraocular pressure so that the pressure may not increase too much that the patient becomes in pain, to prevent the painful drying eye. This is our aim, to prevent the painful drying eye instead of aiming to restore the vision, because the vision has already gone because of the damage of the retina. We can give retrobulbar injection of alcohol, or ultimately we can take the eye out, enucleation. Totally, if nothing else works, then we do the enucleation, which is a process in which we remove the whole eyeball by cutting it from the optic nerve, because it is a very painful dry eye. Then inflammatory glaucomas. Inflammatory glaucomas are because of anterior uveitis. जैसा कि आप लोगों ने uveitis पढ़ा है, if there is inflammation of the iris or ciliary body, it will cause secretion of the inflammatory cells and plasma proteins. They may go and stuck on the angle, right? Angle will not be closed, but there will be hurdle for the aqueous humor to drain out, so the intraocular pressure will rise. It will be called secondary open angle glaucoma because of uveitis. But like these inflammatory cells can make the membrane, or the section of that membrane may be closed. So it will be called secondary angle closure glaucoma because of uveitis. ठीक है ना? तो ये एंगल क्लोजर ग्लाकोमा विद प्यूपिल ब्लॉक मतलब है कि वो पोस्टीरियर सनी की बन गया। आपको पता है कि एंटीरियर यूवेटिस में एक इंपॉर्टेंट साइन होता है फॉर्मेशन ऑफ पोस्टीरियर सनी की। याद है आपको? पोस्टीरियर सनी की इज द एडिशन बिटवीन द आइरिस एंड द लेंस। So when it happens 360 degrees, the aqueous humor cannot come from the posterior chamber through the pupil into the anterior chamber. So it will be pupillary block, and ultimately it will close the angle. And this is the open-ended glaucoma, as I told you, just because of the deposition of the inflammatory particles on the. Now this is ventrolated glaucoma.